Hi everyone, my name is Natalie and I did my speech on how to prevent postpartum depression. In 2017, I was blessed to be expecting my first child during pregnancy. During pregnancy, women face many different types of risk. I ended up facing postpartum depression. Postpartum depression is a stage after childbirth where moms can feel sad and empty even when the most beautiful baby has finally arrived. You can't help feeling this way. I felt empty and sad all the time, and going through it personally, I can say it is the worst experience I've ever had. I wouldn't want any other moms to go through it as well. There have been studies on postpartum depression to give you more information on how to know when it is affecting you, how to prevent it, and how to treat it. Postpartum depression is one type of mood disorder. There are many signs that can let you know if you're going through it. The most common symptoms are sadness, mood swings, anxiety, and feeling overwhelmed. According to Mayo Clinic's, postpartum depression may be mistaken for baby blues at first, but the signs and symptoms are more intense and last longer. It may eventually interfere with your ability to take care of your baby and handle other daily tasks. These are other symptoms that can let you know if you're going through postpartum depression. Depressed mood or severe mood swings, excessive crying, loss of appetite, insomnia, hopelessness, severe anxiety, and panic attacks, thoughts of harming yourself or your baby. While going through postpartum depression myself, the symptoms I faced were crying, severe mood swings, and thoughts of harming myself. My day consisted of me crying, telling my partner I was going to hurt myself, and sleeping in most of the day. This is how I knew I was going through depression. It is very common to face postpartum depression after childbirth due to all the hormonal changes the body is going through. Depending on each individual, all the symptoms are similar but different in each way. Some symptoms are more dangerous than others because it can result in hurting yourself or someone else. Although there's not a 100% cure of preventing postpartum depression, there are ways to lower the risk, manage it. There are over 4 million live births each year in the United States, nearly 800,000. Or 20% of these numbers will experience an episode of major or minor depression within the first 3 months of postpartum. The 800,000 are women who suffer minor depression caused by numerous known psychological and social risk factors. A few recommendations would be to prepare yourself before baby arrives. A baby comes with a lot of responsibility, so planning your schedule out and what you will need, like babysitter, emotional support, care, etc., will help you feel less overwhelmed. The mothers who suffer postpartum depression typically are the ones who are going through a lot. Most of these women are going through psychological or risk factors. Women should get healthcare treatment and focus on self-care. It is important to tell your doctor as soon as possible if you're concerned about postpartum depression. Your doctor can monitor you during pregnancy and after. Postpartum depression is still a widespread concern that has yet to find a more effective treatment. Postpartum depression is often treated with psychotherapy and also called talk therapy or mental health counseling, medication, or both. Depending how depressed someone is, treatment varies for each individual's need. Postpartum depression symptoms usually improve. In some cases, postpartum depression can continue. Becoming chronic depression, it's important to continue treatment after you begin to feel better. Stopping treatment too early may lead to a relapse. It is important to continue treatment for as long as possible as you won't relapse or get worse. Taking care of yourself helps yourself and will help you take care of your newborn better. Individuals will have different necessities. If you're planning to have a baby and have suffered through any kind of mental health problem, consult your doctor. Your doctor will monitor you throughout your whole pregnancy and after. Most new moms experience postpartum baby blues after childbirth. It is important for moms to experience postpartum depression, and it is better if you ask for help. In most cases, your doctor will recommend therapy and medication. In most cases, after treatment, symptoms usually improve. It is important to continue treatment after you begin to feel better. Thank you, everyone, for listening.